That's an excellent question. In terms of the near point of convergence, the normative data do say about 2 inches for the break and 4 inches for the recovery, which is actually closer to 5 centimeters and 10 centimeters. So I'll have to make that correction. I'll work with Jessica on the slides for that. So I apologize. But that's referenced specifically to the nose because originally when those data were generated, we were mostly from a clinical perspective, looking at near point of convergence measurements from the tip of the nose. And we would say that you can also say, oh, it goes to the nose. That's how I know that reference point. In terms of if you go for the bridge of the nose, it probably would be closer to, 6 or 7 centimeters. And then with a recovery 5 centimeters out from that. That's the big thing. The idea should be that recovery should be within 5 centimeters of the break. For example, sometimes I've had providers say to me, referral sources say, the near point of convergence is fine, it's 2 inches. And then I will say, well, what was the recovery? And then there'll be crickets. Okay. And they're like, I don't know what you mean. What is a recovery? And I said, well, that's the other part of the test. Because just because a person breaks at 2 inches and you go, that's fantastic, super. But what if they recover at 12 inches? That's a problem. That means when they read for a while over time, they're like, oh, my eyes are so tired. And they start to close one eye and then they're getting headachy and then sleepy.